how are you? This is Dr. Agata. I'm a consultant neonatologist at Emirates Hospital at Jumera. Today we will talk about prematurity. If we want to know about the data, WHO, which is World Health Organization, established that around 15 million babies are born as a preterm each year. It's a huge number, and it means that 1 out of 10 babies come to this world too early. Since our topic is about prematurity, I would like to welcome our very special guest, the mother of Faye, who was born as a preterm, Noor, and Marites, who is a charge nurse of neonatal intensive care unit. So I hope Noor will be able to share with us a little bit about her journey in the NICU. So Noor, can you tell us a little bit about yourself and your daughter Faye?
So my name is Noor. My daughter is a micro-preemie baby who was born at only 25 weeks plus 5 days. It was a very unexpected journey. I did not expect her to come this early, but she is a miracle baby that my husband and I believed in her, and so did Jumera Emirates Hospital, the NICU team. Everyone believed in her. She thrived and fought for her life, and everyone believed in her, myself, my partner, and everyone at the NICU team.
Oh, thank you so much. It's good to know. I hope we'll be able to see little Faye shortly. And so can you tell us how long did it take for you and your daughter to finally leave the neonatal intensive care unit?
So it took us 138 days. Which was extremely long, very challenging journey, very stressful journey as well. But we couldn't have made it without the support of each and every nurse and every doctor at the neonatal, I would say, unit.
Usually when the baby is born prematurely, and as a neonatologist, we have time to talk to the parents. We give them information of what is coming and what to expect, and how to manage the visitation, how to manage lactation, and what can happen to the baby during this long journey. As far as I remember, we didn't have a chance to talk before you gave birth. Yeah. Would you think it would be better for you to have this knowledge before delivery?
So the thing is, with the prematurity, you never know when the baby's gonna come. It's very unexpected. I had no clue that she would come this early. I have been told that she will not even be born alive. So that uncertainty, you try to also keep thinking positively that she will make it to full term. But it was a very unexpected journey. I don't think anyone is prepared for it, or anyone is prepared for the due date of the baby. However, I feel like I was educated as soon as I put my foot into the NICU.
So tell us about this first day.
Oh, this first day of meeting my daughter, or
yes,
giving birth?
Your daughter.
Extremely emotional. I cannot even explain the feeling. First of all, it's extremely hard to actually accept that once the baby is born, you don't get to meet her until 3 days of her birth, or until, let's say, the next day, because you're extremely tired, you're under a lot of stress and anesthesia, and until you realize that there's someone you need to visit. And it was very tough, I would say, in the beginning. Just entering, it's a bit overwhelming, because you never expect that kind of approach of how you're gonna meet your child for the first time. Seeing her in the incubator was gave me so many mixed emotions, I would say. It was a relief to see her there, and just to see that she's present, but also it's a bit too stressful to see her with the machines and everything plugged to her, and just hearing the sounds and being surrounded by the different sounds and the, I would say, the environment of the NICU. So I would say, yeah.
So in the NICU, Noor, did you feel welcomed and supported by the NICU staff, well informed and empowered?
So as soon as I entered, I had no idea what I was getting myself into, just like any parent, because we're not familiar with the NICU journey, because we never think that we would become a mother of an NICU baby. And as soon as I set my foot into the NICU ward, I was welcomed, I was briefed on what to expect, I was told about my daughter's situation. I was also taught about how to properly care for her, all the safety precautions that we need to go through while entering the NICU. And I was also educated on breastfeeding and on breast milk in specific, and how important it is for the growth of my daughter. So this was all taught to me as soon as I put my foot into the NICU ward.
Okay, that's good enough. We're doing our job well. Yeah. Okay, do you still remember your first kangaroo mother care or skin-to-skin contact with your baby? Would you care to tell us more about your experience?
Yes, I remember this day extremely well, which was on the 16th of October. I will never forget it, of 2021. And it was with the beautiful presence of my Dr. Agata. It's a very unforgettable experience. You're very afraid to carry her just because she's extremely tiny, and it's the first actual contact that you have with your baby, because in the beginning it's extremely crucial. You know, you're not allowed to really touch her just to avoid any infections, and you're always taking that extra care. But once you have the opportunity to finally do kangaroo care, you feel so at peace, so at ease. And doctor made me extremely comfortable. She was with me the whole time, making sure that Faye is managing well, and you feel just this warmth and connection, because you've been detached from your baby for so long that you haven't even had any contact with her. Yes. And just the kangaroo care brings you way closer to your baby. And fun fact, it actually encouraged your milk supply to increase. Yeah. Yes. And my husband, the first time he did kangaroo care, actually cried of emotion. It was the first time he was attached, but he felt even more attachment to his daughter.
I'm so glad to hear
that. Yeah. Actually, that's the main reason why we really promote kangaroo mother care, because of, you know, the several benefits that it offers to not only the baby but also the parents, especially the mothers. For the babies, usually medical research has shown that maternal and infant skin-to-skin bonding will promote better brain development, emotional development, less stress for the baby, as you have said, increased milk production, and less apnea attacks. And it is also more than the incubator, it is the best way to thermoregulate a baby. So the baby's temperature will be maintained when the mother is doing kangaroo care. So for the parents, you also have a lot of benefits. As you have said again a while ago, that you felt a lot more bonded with your child, and less, you know, emotionally you became a little bit stable, and less guilt, less depression, milk production is increased, and you become empowered and more confident on how you will handle your baby, and you become more calm emotionally, right? Yeah.
This is why in this neonatal intensive care unit at Emirates Hospital at Jumeirah, we specifically promote kangaroo care. Each kangaroo care requires to have established protocols, which babies can be given to the parents for kangaroo mother care, which mothers needs to wait a little bit longer. So nurses needed to be trained, and this is what happened. So I am a very huge believer on kangaroo mother care, and actually this practice came from the low-income countries. There was a doctor in, I believe, Central America, as far as I remember, who saved many babies for whom there were not available incubators, simply by putting them on the mother's skin. So these mothers were incubators for the babies, and those babies were surviving. So still in many low-income countries, that's the main purpose for doing kangaroo care. We live in Dubai. The hospital is serving the quality of level 3 neonatal intensive care unit. So the purpose for kangaroo care from our side is what Marites mentioned a while ago. This NICU also is a family-centered NICU. What it means, we focus on the family, on the multi-level areas, from supporting milk production, information given to the parents, but also through involving them in the treatment process and decision-making process. So my question to you is whether you felt involved in this treatment, managing the journey of Faye, both you and your husband. Did you feel included and as a part of NICU team?
I would say one of the big benefits, positive benefits of the NICU ward here at this hospital is basically that you have the right to visit your daughter any time that you wish for, even if it's in the evening or if it's early in the morning or if it's in the middle of the night. You are part of the NICU family. You become part of this family as soon as your baby gets admitted. So that feeling of freedom and that feeling of having that right to freely go see my daughter, spend most of my days. I used to start my day by heading to the NICU early morning and then just leaving by the evening. Not every parent is forced to go through that routine. It's what makes them comfortable. Some just like to come visit for an hour, some like to spend the day there. I preferred spending the day there just because I felt welcomed by everyone. I felt more at ease, more at peace just by seeing my baby develop, and I felt much more connected to her as well just by sitting and just watching over her. I felt like I'm protecting her, and so did my husband. So we were blessed by having no visitation timings, and I encourage literally every hospital to have that implied into everyone's NICU journey.
Since Faye stayed in the NICU for 137 days, and I remember those days of being better and more stressful for all of us, did you feel sufficiently informed about what we are planning to do with your baby and why?
Yeah. Of course, I would say the first 2-3 weeks are always unexpected because they're always crucial. It starts with the first 3 hours of birth are important, and then the first 24 hours, and then the first 3 days. So I was always told that basically we monitor her in the first 3 hours, and then we monitor her the first 24 hours of life, and then the first 3 days of life. So I would say definitely I was involved, and I was informed on what to expect out of her. Obviously, the NICU journey, we don't always know what's going to happen to our baby, but we try to get as much information, and doctors are, I would say, ruthless. They would literally reach out to all possible resources. They would go above and beyond to ensure that Faye is developing properly, is taking all kinds of medical care that she needs given her situation. She was born with BPD, which is extreme premature lungs. So that specific topic was very crucial to her development, and Dr. Agata kept reading into it, making sure she's up to date with all the new medical care for this specific, I would say, disease. And she pushed and went above and beyond and kept researching and doing whatever it takes, from 4 in the morning or running at 6 in the morning, heading to the NICU to make sure that Faye is responding to all the medical care that Dr. Agata has implied into her treatment.
Thank you so much for these kind words. To be honest, Faye is the first patient in my 30 years career as a neonatologist whom we have to send home on the home oxygen. So this was after she was discharged. So as a final questions before we end, would you like to tell a few words about this struggle? The battle, did you won as well? And how is Faye now?
Yes, so Faye was discharged on the 11th of February of 2022, and she was on oxygen up until the 22nd of June of 2022. I would say the first week was extremely challenging just because we were learning of how to juggle the oxygen machine, how to take care of a baby on oxygen support, and it wasn't just for a few hours. It was a 24-hour support, so it was a bit tough in the beginning, I'm not gonna lie, but my doctor was always there for me whenever I had questions or I had any doubts of any technicality that whatever is with the monitoring of the machines, and I never felt alone, I would say. So I had all the support I needed in this crucial step of our daughter's development, and we were over the moon as soon as she was off oxygen. We couldn't believe it. She thrived. We believed in her. We prayed for her. We made sure that she has all the care she needs to become, I would say, a very healthy baby. And we are here today. She is 1 year old, 9 months old corrected age, and she is as if nothing happened to her. She is extremely naughty. She is playful. She loves people. She loves to interact with everyone, extremely friendly. And she is extremely active given her case. So we believed in her. She proved us right, and I'm so happy to see where she's at today.
Well, thank you for sharing this, and I hope we will see Faye in a while. So finally, Noor, closing this discussion, would you say something very special from your heart regarding the challenges related to having the baby in the NICU to empower mothers who maybe currently go through this process?
I would say it is a very difficult journey. It's hard to deny that. Not being able to carry your child as soon as you give birth to her and taking her home, going through the challenges, the ups and downs of the NICU, and in parallel, a lot of peer pressure comes out of it. You will have support from all your close friends and your family members. They will be asking you on a daily basis, how is she? How is the baby? How are you feeling? And it's extremely hard to answer these questions on a daily basis because the NICU journey is, you need to take it one day at a time. It's impossible to just predict that it starts on a good path and it continues on a good path. It's an ups and down journey, and I would say that the peer pressure of constantly reassuring people around you can be a very I would say a stressful factor into your journey. But at the end of the day, everyone who's extremely understanding and close to you will accept the idea that you might not be able to respond to their questions, and it's all coming from a good heart. So you are allowed to feel whatever you want to feel during that journey. If you feel like isolating yourself until everything is fine, do that. If you feel like you need to talk to someone, you need to talk to your parents or your friends, do it. Make sure you are at ease and make sure you are comfortable with sharing your experience. So that is why, personally to me, I focused on just including my parents, because at the end of the day, they have a special bond with her. They get to, I would say, she is their grandchild. Mm-hmm. You know, she is a niece. She is a niece to my sister-in-law. She's a niece to my sister. So it's important to, I would say, fill them in on the journey as well. But don't be forced to do that. Just when you are ready, do it, you know? So make sure you are comfortable, you are mentally prepared for this journey, you have the support of your partner, because your partner is the only person that is allowed to visit your child as much as you are. And just make sure you have that support, you have that great connection with your doctor, and do not hesitate to ask as many questions as you want. They are always there for you. And my advice is keep your head held high. It's so much harder, it's easier said than done, I would say, but keep faith, keep I would say throwing positive vibes, and I promise you it will be something you will not regret doing.
So, thank you for this discussion, Marites. Thank you, Noor. I would love all the babies to be delivered on term, which is 40 weeks gestational age. That's the full-term pregnancy. However, unfortunately, 10% of them are born as a preterm. And medical evidence says that up to 5 babies per 1,000 pregnancies comes to this world before 28 weeks, which is the definition of extreme prematurity. So I am glad that this NICU journey was least painful for you and full of hope and joy and support. And would you recommend for other parents, if they are at risk of having preterm baby, to have this baby with us and under our care?
Definitely, I would recommend them to come to Emirates Hospital Jumeirah. At the end of the day, I didn't feel as another patient. I felt like we had a great connection. You guys became my family. You are Faye's family as well. We used to come in and you guys used to be so positive. You used to give us a lot of love, a lot of support. You were there for us through the lowest points of Faye's journey and even the highest points of her journey as well. So I would definitely recommend it. You guys took such great care of her and you will be in her life for the rest of her life.
Thank you so much. Thank you very much. I hope we can now see this beautiful girl which is sitting there. Thank you very much, Noor. Thank you very much, Marites.
Thank you so much.